to the CONNECT Collaborator Interview Series, where we host 10-minute conversations with healthcare professionals and partners with the goal of encouraging deeper collaboration in the healthcare industry. Today's guest is Kashtin Fitzsimons, Director at the West Toronto Health Team. The West Toronto Health Team is a network of 38 health and social service agencies operating in the West Toronto community, working to integrate care in partnership with patients, families, caregivers, and other providers. Kashtin holds a Master's of Science in Health Quality, Risk and Safety from Queen's University. Welcome, Kashtin. Thank you for joining us.
Thanks so much for having me.
Well, I know when we first chatted, there was some unique things that the West Toronto Health team was doing, and so I wanted to start with, what is the West Toronto Health Team known for approaching healthcare solutions from this patient-led perspective, and maybe you can share some of these examples of how you're tackling these challenges in innovative ways.
Yeah, I'd say what we're best known for at this stage is I think we make a really concerted effort to engage the community, patients, families, caregivers in the design of the healthcare system that they are a part of, that serves them, making them a part of the future of it. I'd say the best example of this is our Climate and Health Hackathon that we hosted in October of 2023 in partnership with Humber College's Office of Sustainability. This was an event that we hosted with 50 plus community members who came together to ask the question, how might we build climate resilience for better human health in West Toronto? And it was just incredible seeing the passion for this topic and really all the creative ideas that came out of it. I think what's really inspiring is it was the community that came up with the ideas, the community that led their implementation, and we're now seeing the fruits of all of that work. We've taken that similar approach in our partnership with Toronto Community Housing and other community organizations to develop what we call a support in housing model, where we bring together lots of different unique services directly within Toronto Community Housing locations. And what I think is the most important part of this is the fact that tenants and other area residents were critical in shaping not only what services are there, but how they're delivered and even how the space looks and feels to make it as welcoming and as impactful as we hope it can be. So really, I'd say above all else, it's making and creating space for patients, families, and caregivers to be a part of leading our health system.
Excellent. And maybe on the vein of the Toronto Community Housing, I know you did work with them to help co-design the iHelp centers, and this is a great example of innovation. Maybe you could tell us a bit more about this project and how it's impacting residents and what's really unique about engaging the community through this.
Absolutely. I think the most unique component of this was we didn't start from a place of there's all this new money, there's all these new resources, how are we going to spend it? We instead started from a place of what is the most important problem that we can be solving as a West Toronto, Ontario health team? And for us, it was evident that we needed to be in our high priority neighborhoods. It was evident that we needed to be tackling the problems that mattered most to community. And to learn those things, we went right to community and we got to know folks in the 100 High Park Avenue area as well as the 1901 Weston Road area, to learn about those lived experiences, those challenges. And we were surprised in many cases by what we learned. The desire for things like grief and bereavement support was made evident as we got to know the community, when our initial assumption or prior beliefs might have told us chronic disease prevention might be the most important. So we learned so much about what it is that tenants and area residents cared about. And then from there, what was really exciting was the passion that these tenants and area residents had for leading this effort in their community. When we opened our doors in July of 2024 of this year, it was a tenant who walked in on the first day and said, I volunteer here now. And she's been, as well as many others, instrumental in shaping what this community looks like. From the decorations we put up, the murals that are on the wall, to the services that are offered, to the kinds of social environments we try to create. That to me has been the most instrumental part in making this project a success, is at every step in the journey, making the tenants, the area residents, front and center as part of the leadership team, and making sure that it represents what they want the center to be today and into the future.
You use the words flexible, adaptive, and person-centered when describing the innovative solutions. What some unique approaches you and your team is engaged in to address some of these people-based solutions, and maybe some of the insights from the initiatives and workshops you've ran?
Absolutely. I think one of the most influential events actually took place just a few weeks ago. Our OHT took part in a design thinking workshop over 2 days with members of our primary care network, so family physicians who participated, community members, as well as member organizations of the West Toronto Ontario Health Team, to learn, yes, about design thinking, but actually in those 2 days, apply those skills to challenges that matter a great deal to our health system. It was really interesting from a physician perspective, all the feedback we got. One physician told us that in those 2 days, we achieved more than we would have normally in 1 year, just giving that focused, creative time to think deeply and empathetically about the problems that matter most to people. Because at the end of the day, our health system is in service of people. It's not this abstracted concept, it's people serving people above all else. We had another physician who told us that this needs to be part of the medical school curriculum, that they want to see design thinking a part of how we approach problems. Because so often in our health system, we think there has to be a right answer as opposed to the best possible answer to us. And through that approach, we were able to think creatively and not presume or come to a solution before even having a conversation. And that resulted in us having really creative conversations, developing creative, flexible, adaptive solutions. And I'm really excited for what 2025 has in store for us, rather. Just given all the creativity and energy that kind of approach elicited from all kinds of stakeholders in the process.
So maybe just to build on that a little bit further, how does your team incorporate this creative mindset when you're developing these healthcare solutions, and why do you think it's so crucial for overcoming these healthcare challenges?
I think what's so common, at least I'll speak from my own vantage point, I think for people I know and people like myself, it's so easy to start from a place of what's the solution. We start by saying, how are we going to do something, instead of starting from a place of what is the problem? And what I challenge myself and our team to do as much as possible is fall in love with the problem. Get really excited about a problem that we want to solve, study it, become obsessed with it, and get to know the people that are most impacted by that problem. And through that discovery, the solutions or the interventions come out creatively and collaboratively. And it's that approach that we found has been the source of the most creativity and the most innovative solutions, as opposed to starting from a place of what's innovative, what's on the trending technology or the trending model. It's starting instead from a place of what is the problem that matters most to this client or to this community or to this neighborhood. And when we design for that, we find that it actually is more universally applicable than we tend to realize. There's some really great examples in the world of technology. An example that comes to mind is when you look at the Amazon Alexa product. It's almost a ubiquitous product in many homes these days, but it was designed initially for folks who don't have the ability to operate a computer with their hands and with their eyes, and instead using their voice only to operate a computer that you or I have come to use every day. And that design principle is what made it so universally applicable to anyone. So when we design for communities that are often underserved in our health system, we tend to create more accessible solutions. We tend to create models that produce better results more efficiently. And that to me is what's most exciting about this approach to innovation. It's starting from a place of becoming obsessed with a problem and allowing ourselves to go on that journey of discovering with community, with patients, with caregivers, with providers, what that solution ultimately may become. And that could be quite daunting. A lot of us are planners. We want to know what the destination is before we start the journey. But we start from a place of, let's start with that problem. And that to me is really critical to our process.
I love that, starting with the problem and really being that problem focused. Maybe you could tell us what you're looking forward to in the future around person-centered care models.
I think for us, I look to our Partners for Better Care Council, which is a partner patient family advisory council that offers us not only guidance, but leads us in thinking about community engagement and how we should be thinking about health system transformation. And what I'm most excited about is what they're most excited about in this case, which is how we can go about harnessing and empowering community members to drive our health system and to be there for one another. We think about times in our lives where we're most vulnerable. Perhaps there's been a loss or there's been a hard diagnosis to receive. It's often family, friends, sometimes even a neighbor who's there for us. And we've spent a lot of time thinking about how do we empower our communities in West Toronto to be a part of that and be there for one another. And we think a lot about what would our communities look like if that were true for everyone, if there was that neighbor in a time of need. There are models all across the world. An example in our climate and health work that we've studied is in Paris, France, where they've had really high rates of morbidity related to heat waves. And they've created a volunteer registry where, I might call my neighbor to check in and make sure, are you doing okay? Is someone there for you today? Do you have access to water or a place to cool down? And that's not an overly medicalized model. It doesn't even require a clinician or a paid staff member. It's just trying to create structure around what we as humans innately want to be doing, which is connecting with one another to make sure people around us are safe, happy, and healthy. And if we as a health system can empower communities to do that, we know the talent and the care is already present in our communities. So it's a matter of getting out of the way and offering support where it's needed. And that's one area where we're really excited. And I know our communities are really excited too.
And that's fantastic. I love how you're taking the patient empowerment to community empowerment and evolving that whole framework. I had one last question here around if there was any other unique solutions that your teams implemented to address patient needs in the community, and how those might differ from traditional approaches. And this is an opportunity if there's something new or different you'd like to help share with us.
I think we've talked a lot about the iHelp centers, and I think the area that just from a practice of engaging community that really excites me is the work we've done to build community resilience for our climate, because I think it's a model that is quite generalizable to our health system more broadly. The story I'll share, and it's featured on our website, so I'll give a brief plug, is a story of a mother and daughter who came to our climate and health hackathon, who had experience directly with the issue of extreme heat, worsening air quality. I'm sure many of you, listening to this can remember the summer of 2023 here in Canada. We had one of the worst wildfire seasons in our recorded history, 10 times the average amount of wildfire smoke compared to the average summer. And when we went to community for events, many people would come to us and say, what do we do about this? Is it safe for me to be outdoors? How does this impact my asthma, my COPD? And so when we hosted our climate and health hackathon, this mother and daughter duo attended, and they said, this is an experience that we have direct experience with. Living in a high-rise apartment building off of a highway. I'm sure many people listening can relate to that lived experience. And crucially, in an apartment without air conditioning. And what they said was, we have our own set of products we use to drop the air temperature, or the in-home temperature, from up to 10 degrees Celsius down. So 35 degrees down to 25 degrees, which for folks who use Celsius, that's a big, big difference, particularly in the summer months. We took their input of exactly which products they buy, how they set them up, and then over the summer of 2024, we distributed close to 150 of these climate resilience kits in the Weston Mount Dennis neighborhood. And still to this day, I have community members coming up to me saying, people ask why it's so cold in my apartment in the summer months now that I have this climate resilience kit. They feel the difference in the air they breathe, their mood, their health overall. And that to me was when we stepped back and we said, we're really interested in this problem. And we asked community members, what do you do to solve it? And we just share their idea. That to me is so powerful, and we're excited about applying that principle, not only to this topic of climate resilience for better health, but for how we improve mental health outcomes in our community, how we better manage chronic illness, how we make aging a much better experience in West Toronto and other places. So that to me is a story that I care deeply about. because it's about a family who had a problem and wanted to share it with others, and it made a real difference.
I think that's fantastic how you're showing the collaboration really driving the innovation. Thank you again for joining us, Kashtin. I want to wish you best of luck, and I look forward to following your journey and seeing all the innovations coming from the West Toronto Health team.
Likewise, I hope there are many innovations to come.